Hey, I'm Alexander Jasper-jay, and today I'm going to be talking to you about Bernard Norman Barwin. He was once one of the most respected doctors in the country, even being appointed to the Order of Canada. It's one of those awards given to you by the Governor General. Basically, it's a big deal, and he just so happened to be the first person ever to prescribe me testosterone. And trust me, that is not a point of pride, because though he used to be one of the most respected doctors in the country, he is objectively the most horrible man I have ever met. Unfortunately, I do have the day that I met him tattooed on my arm, because it just so happens to also be my testosterone date, because he's the person who prescribed me testosterone. And I used to look down on my arm and feel nothing but joy and pride and accomplishment, because that was something I worked so hard to achieve. But now I look down on my arm and I'm definitely conflicted, because though I still do feel like a little bit of joy and pride and accomplishment, because it's still something that is significant in my life, it's definitely tainted knowing how many people Dr. Barwin hurt. On one hand, this story ends with me being a stroke risk in my early 20s because he took me onto his care and then abandoned his practice only a few months into my care, before my levels had a chance to stabilize. Once they did stabilize, my levels were twice as high as they needed to be, but I didn't have a doctor who was knowledgeable enough about HRT to correct that. And that's bad enough, but on the other hand, this is a story that will never end for a lot of people. My life was changed significantly, but it's barely a drop in the ocean when you consider how many families will be affected for generations by this man who they called the baby god, because he took it upon himself to actually play God.
Probably the highlight of my career was, apart from my family, of course, which is always a highlight, to have your children and then your grandchildren.
They are siblings conceived with the sperm of Norman Barwin, a once respected Ottawa fertility doctor who is now disgraced and facing unprecedented legal action.
I can't tell you the joy one feels when patients come who've been unable to get pregnant, and that kind of every day it's a highlight when you get a positive pregnancy test and you share that with someone.
For the first week or so, I felt very dissociated with my face, my body. It was suddenly that these features and physical characteristics that had always been mine might actually belong to someone else out there, and I didn't know who it was.
And I hope, after the hurt that there has been, is that they will be happy with the child that they have and enjoy that child.
Between the 1970s and 2014, Dr. Bernard Norman Barwin inseminated 100 to 150 people using the wrong DNA sample. And in some cases, the sample that he used to father these children was his own. He fathered at least 11 of his patients' children without their consent, and he technically wasn't even qualified to work as a gynecologist in Canada. So how does this happen? I wish I had an answer to that, but what I can do is try to provide as much context as I possibly can. Barwin was born in South Africa, educated in Ireland, and when he moved to Canada in the 1970s, he was hired on at the Ottawa General Hospital to work in their high-risk pregnancy unit as the director and as the co-director of their fertility clinic. It wasn't until 1984 that he took an exam to become certified as a gynecologist in Canada, and he failed. He subsequently left his position at the Ottawa General Hospital and opened up his own clinic at 770 Broadview to continue practicing fertility, and there he also practiced transgender care. So not only was this man regarded as the baby god, but he was also worshipped by the local trans community because he was the only one at the time prescribing HRT. In 1995, a lesbian couple stepped forward and alleged that Dr. Barwin had used the wrong sample during their insemination process, resulting in their child not being biologically related to their intended donor. They settled out of court in 1998, and to be honest, that whole situation didn't really get a whole lot of attention. For context, gay marriage wasn't legal in Canada until 2005, and despite what people think, Canada isn't some magical land where prejudice doesn't exist. So unfortunately, it's not like a bunch of people are going to rally behind these women, and because there wasn't that much attention, the College of Physicians basically just ignored the whole situation. So things seemed quiet for a few years, and apart from Barwin cheating at the Boston Marathon by cutting multiple checkpoints and thus getting banned from the event, it wasn't until 2010 that two more women stepped forward to allege that Barwin had used the wrong sample during their insemination process, but they also each requested that Barwin provide a sample of his own DNA to rule out the possibility that he may be the biological father of their children. So Barwin refused, and initially he also refused that he did anything wrong until 2013, and that's when the College of Physicians stepped in, and also when he lost his spot in the Order of Canada. So the College of Physicians really didn't do that much. They only suspended his license for about 2 months, fined him about $3,000, but they did stop him from running a fertility practice. So when he started up his practice again after his 2-month suspension, he focused his practice more on the transgender care aspect of it. I was actually referred to Dr. Barwin by my counselor, and my counselor was somebody that I was talking to for well over a year and somebody that I trusted. So when he told me that Barwin was an old man who made a simple mistake, I was inclined to believe that. Barwin's defense to this whole situation was that he used his own sperm to calibrate some of his equipment, and it didn't get sterilized properly, which essentially led to playing Russian roulette with biology. And my counselor really did the most to make this not sound as ridiculous as it is. So because I had been talking to him for well over a year and we had that established trust, but also because I was just so desperate to get my life started, I believed him, and I became one of the last patients Dr. Barwin took into his practice. And just so you can understand just how late I was brought into his practice, it was during my second appointment with him that he informed me he was going to be retiring. I didn't know it at the time, but I'm fairly certain now that the reason he retired was to avoid any more allegations coming to light, but they inevitably did. At the time, Dr. Barwin was only one of 2 doctors prescribing HRT in Ottawa, so when his practice abruptly closed, it left a lot of trans people stranded, myself included. But ultimately, he shouldn't have been practicing. This man shouldn't have even been a doctor. And by the way, I know this isn't necessarily relevant, but I do think it plays to his character because he lied to me. Barwin started all of his testosterone patients on testosterone pills, and when I asked about concerns with liver function, Barwin informed me that the pills actually bypass the liver and it is no more harmful than injections. Now, however, those pills are no longer available in Canada because it was known that they caused liver damage. So I'll say it again. This man really should not have been a doctor, and thankfully he isn't now. And that's largely because in 2015, Kat Palmer, who knew she was a Barwin baby and whose parents were proud she was a Barwin baby, and who personally knew Barwin because they were both active within the local Jewish community, she took an at-home DNA test which indicated that her ancestry was different than what it should have been had her biological father been the intended donor. The site she used also connects you to relatives who have also used the service, and one of the people who had used the service was Dr. Barwin's cousin. When Kat Palmer discovered that connection, she emailed Dr. Barwin questioning her paternity. At that point, Dr. Barwin surprisingly actually agreed to do a DNA test, and when the DNA test showed he was in fact her father, he sent back an email letting her know. It was around that time that Rebecca Dixon was diagnosed with celiac disease, which is a genetic condition that neither of her parents had any family history of. She wound up getting her blood typed during this whole process, and her blood type wasn't compatible with her father's blood type, and so they took a DNA test which concluded that her dad wasn't actually her biological father. So she began questioning her identity and her biology, and she tried getting in contact with lawyers, and she tried getting a DNA sample from Barwin, who refused. So at that point she got in contact with Kat Palmer, who provided her a sample of her DNA to test against. The results of that DNA test showed that they were in fact paternal half-siblings. So at this point, things started getting picked up by the media, and it started a snowball effect where more and more people were discovering that their biology wasn't what they thought it to be. So in 2016, they filed a class action lawsuit that currently has 150 people being represented. And that number does include people who stored reproductive material with Dr. Barwin before undergoing things like cancer treatments, because a lot of those samples were just lost. He also extended those services to trans people who were about to undergo HRT or bottom surgery, and I can't imagine that those samples remained untouched either. It wasn't until this year that there was a hearing to actually revoke his medical license, and reading over the notes of that hearing is absolutely horrific. So I'm going to give you a couple of examples from the hearing, but before I jump in, I do need to let you know that in these notes, Rebecca Dixon is referred to as Miss AA, while Kat Palmer is referred to as Miss BB. Patient E. Patient E and her husband went to Dr. Barwin for infertility treatment in and around 1982. They were unable to conceive a child and decided to try to conceive a child through artificial insemination provided by Dr. Barwin. The insemination was to be performed by Dr. Barwin using a donor sample chosen by Patient E. Patient E specifically requested that Dr. Barwin use a donor who resembled her husband. Dr. Barwin represented to Patient E that all of the inseminations were performed using the donor sample chosen by Patient E. Patient E conceived through the treatment provided by Dr. Barwin and had a daughter in the 1980s. Patient E and her husband returned to Dr. Barwin again for infertility treatment in 1986. The insemination was to be performed by Dr. Barwin using the same sample that was used for her daughter, so that her daughter would have a full biological sibling. Patient E told Dr. Barwin that this was very important to her, and Dr. Barwin told her it was the same donor. Patient E often felt that her first daughter resembled Dr. Barwin, but she would push those thoughts aside, because she could not believe that Dr. Barwin would have used his own DNA to father her child. Patient E and her husband saw media coverage about Miss AA in 2016 and noticed that Miss AA resembled their first daughter. Patient E's daughter subsequently underwent DNA testing, which confirmed that her first daughter is the half-sibling of Miss AA by the way of the same biological father. Dr. Barwin is that biological father. DNA testing revealed that Patient E's other daughter is not the biological child of Dr. Barwin. This means that Patient E's children are biological maternal half-siblings, rather than biological full siblings. Patient E's family found this traumatic. Patient K. Patient K attended Dr. Barwin for fertility treatment in and around 1991 to 1993. Patient K underwent 11 artificial insemination procedures provided by Dr. Barwin. The artificial insemination was supposed to be performed using a donor selected by Patient K from donor profiles provided by Dr. Barwin. Patient K reviewed the donor profiles Dr. Barwin provided and selected a donor based on the donor's medical history. The donor number selected by Patient K was stored in her patient chart, and Dr. Barwin represented to Patient K that all of her inseminations were performed using the same donor she had selected. Patient K conceived through the treatment provided by Dr. Barwin, and her son was born in the early 1990s. Patient K decided to have a second child and returned to Dr. Barwin for further inseminations after her son was born. Dr. Barwin knew that Patient K wanted her son to have a full biological sibling. Patient K became pregnant again through the treatment provided by Dr. Barwin and had a daughter born in the early 1990s. After her daughter was born, Patient K requested a copy of the donor profile she had selected from Dr. Barwin. Dr. Barwin provided Patient K with the donor profile, but it was not the one she had selected for her children. When Patient K pointed out to Dr. Barwin that the profile she had been given was not the donor she had selected, Dr. Barwin told Patient K that she should just be happy she has 2 children. Patient K was upset because it was important to her for Dr. Barwin to have used the donor selected and to have the information about that donor. After seeing media coverage about the lawsuit against Dr. Barwin, Patient K obtained DNA testing for her children, which confirmed that they are biological maternal half-siblings rather than biological full siblings. This confirmed that, contrary to what she had been told by Dr. Barwin's clinic, Dr. Barwin did not use the same donor for both of her children. In the conclusion provided by Dr. Hughes, he said, "Did Dr. Barwin's practice fall below the standards of care for that time? Absolutely. Was his knowledge below standard? Uncertain. Were his skills below standard? Yes. Was his judgment below standard? Yes. Was harm done to patients? Yes. This was a tragic situation in which a sea of avoidable harm was done." So the result of this hearing was that he did lose his medical license, and he was fined about $10,000 for the cost of the hearing that he didn't even bother to show up to. The class action lawsuit is still underway, but this man is in his 80s and he's frail, so I don't know if these victims will ever see justice, but I hope that they do. And unfortunately, there haven't been any criminal charges. This man is still walking around Ottawa. He's still participating in the community. This seems to me to be just an incredible blind spot in the law, and I'm hoping at minimum that these events at least highlight that enough that some change is made. But I think for obvious reasons, I'm not confident that that will happen. I haven't really figured out a way to end this video because this story doesn't really have an end, but it's something that's been making me just so uneasy for years, and I wanted to talk about it. Learning the details of this situation has definitely made me question a lot of things in my life, but it's definitely made me question the whole concept of trust your doctor that they hammer into you as a kid. Yeah, I'm just really uneasy, and I'm sorry if I made you uneasy, but thank you for listening to me and sitting with me through this whole ordeal. So I do hope that you have a wonderful day, and if you get the chance, please go and follow me on Twitter, because that is where I ask people for the most feedback with what I should be making. So if you want to see more content like this, you can let me know over there. If you don't want to see more content like this, you can let me know over there, or you can just let me know down in the comment below. The whole Twitter thing is really just, I get the most feedback over there, because I talk feelings and thoughts, and I rant and ramble, as you can probably tell. Anyway, yeah, peace out, Scout people. I shall see you soon. Bye!